All right, so scan was complete, and for those who have not had a PET scan, um, it does take some time. They do, when you arrive in the chair, they check your glucose level. They want to make sure it's at a normal range, and then you get an IV placed, and they place the medicine slash dye into you, and you have to wait an hour, and then they take you back to the scan. And I did take a couple pictures to show, if you've not seen what one looks like. If you do struggle with like being claustrophobic, you may want to recommend getting some kind of medication to comfort you that you've done in the past. It's very similar to the size of a CAT scan. I was able to, keep my watch on and my rings on and my jewelry on, as long as you can put your hands above your head, which is nice. This PET scan doesn't require a lot of direction like CAT scans. They're always telling you breathe, pause, hold your breath, those kind of things. This one's kind of nice. You just get to lay and relax. It takes about a half hour. It's quiet. There's no loud noises, much like an MRI makes. So all in all, it's kind of a peaceful test, as long as you're able to relax in closed space. They had a real cool cloud visual in the ceiling that I was finding myself looking at, and I found a little heart, which I thought was cute. So that's just what I wanted to share with you guys. For those who have not had a PET scan or kind of were curious about the differences between going into the PET scan machine versus CAT scan and MRI. So thanks for watching. I do have my first chemo infusion appointment on Monday, and I will share how that goes as well. So I thank you. Everyone have a great day.